Hello everyone, myself Damini Gupta, BMS first year student batch 2018 and 19, Shriram Ayurvedic Medical College and Hospital, Meerut. My topic is anatomy of spleen. Introduction. Spleen is a lymphatic organ connected to blood vascular system. It acts as a filter for blood and plays an important role in the immune system. It is the organ found in virtually all vertebrates. Location. Spleen is a wedge-shaped organ lying mainly in the left hypochondrium and partly in the epigastrium region. It is tetrahedral in shape. Dimensions: length 5 inches or 12.5 centimeter long, breadth 3 inches or 3 or 7.5 centimeter broad, thickness 1 inch or 2.5 centimeter thick, weight 7 ounces and related to 9 to 11 threads. Position. The spleen lies obliquely along the long axis of the 10th rib. Thus, it is directed downwards, forwards, and laterally, making an angle of about 45 degrees with the horizontal plane. External feature. Spleen has two ends, three borders, two surface, two angles, and hilum, two ends. Interior or the lateral end is expanded and directed downwards and forwards. Posterior or medial end is rounded and directed upwards, backwards, and medially. Three borders. Superior border is notched near the interior end. Inferior border is rounded. Intermediate border is also rounded. Two surface. The diaphragmatic surface is convex and smooth. The visceral surface is convex and irregular. Two angles. Anterobasal angle is the junction of superior border with lateral end. Posterior basal angle is the junction of inferior border with the lateral end. Hilum. It lies between the superior and intermediate borders. It is pierced by the branches and tributaries of the splenic vessels. Relations. Peritoneal relation. The spleen is surrounded by peritoneum and it is suspended by multiple ligaments as follows: gastrosplenic ligament, leonine ligament, phrenic colic ligament. Visceral relation has some impressions: gastric impression, renal impression, colic impression, pancreatic impression. Hilum lies on the inferior medial part of the gastric impression along the long axis of the spleen. Arterial supply. Spleen is supplied by splenic artery, which is the largest branch of celiac trunk. Venous drainage. The venous drainage of the spleen occurs via the splenic vein, which also receives blood from the inferior mesenteric vein. Posterior to the neck of the pancreas, the splenic vein unites with the superior mesenteric vein to form the hepatic portal vein. Lymphatic drainage. The lymphatic vessels of the spleen follow the splenic vessels mentioned above and drain into the pancreatico-splenic lymph nodes and ultimately the celiac nodes. Nerve supply. The nerve supply to the spleen is from the celiac plexus. Function of the spleen: traps blood-borne antigens and microbes, plays major role in mounting immune response to antigens present in bloodstream, major filtering function performed by macrophages, line up by the splenic cords, trap the circulating silver and process them and send to them the white pulp. Accessory spleens or spleniculi. An accessory spleen is a small nodule of splenic tissue found apart from the main body of the spleen. Accessory spleens are found in approximately 10% of the population and are typically around 1 centimeter in diameter. They may resemble a lymph node or a small spleen. Clinical anatomy. A normal spleen is not palpable. Splenomegaly refers to enlargement of spleen. Splenectomy refers to surgical removal of spleen. Splenic puncture, rapid pain occurs in epigastrium. Thank you.